Good afternoon. What's up? It's good to be in Missouri. Or is it Missouri? Depends if you have money. This is an interesting moment. The tragedy of Virginia Tech has to do in part with needless deaths, that for every practical, humane, ethical reason, people that should be alive today are dead. We don't know all of the motivations and all of the reasons and what's in the organizational culture of our country and what drives people to do what they do. But I submit to you that the reason why we're here is in part to prevent needless deaths. And if you are outraged about what occurred at Virginia Tech, ¿qué pasó? Yeah, it should be on. Can you listen to me now? How do I look? You told me not to stand back here. I'm embarrassed. So one of the great challenges that we have in the United States of America is to figure out how to connect people to what already works. We need to do research on the things that are not working. But the real tragedy in healthcare in American society is that we know what works. We just don't always know how to connect it to the people that need it. And I gotta tell you that one of the greatest, most significant cultural competency that you could develop is the ability to talk about what we're failing to do in ways that do not destroy, alienate, and cause people to shut down regarding what needs to be done. I want to say that again. When you talk about healthcare disparities as they are impacted, stigmatized groups, one of our great challenges is to look at the gaps, look at the mortality rate between those who have privilege and those that do not. And see the gap. And one of the most outrageous stats have to do with the fact that black women, for example, least likely to get breast cancer and more likely to die from it. And I have been in places where people have shut the door, fired up the slides, looked at the stats, and then have provided motive to why the gap exists. So that the moment I say that you're racist and insensitive and uncaring and elitist and money hungry, and that's the reason why our people are dying more often than other people, I lose the ability to secure the buy-in from significant stakeholders to get it done. And so one of the biggest, most important challenges is that when those of us that God in His wisdom made to be members of groups that we categorize as minorities, if the truth be known and you look at the demographic shifts, the fact is that we're emerging majorities. But to the degree that we belong to these groups, and we have a responsibility to get your buy-in to do something, we've got to do it in a way that at the end of the day, you don't walk out of here somehow feeling embarrassed for the way that God has made you. And so one of the great challenges that we have in America is not just to have the cultural competences to effectively communicate across comfort zones and identity lines. The issue of sexual orientation is huge in healthcare. For what reason? That, simply put, it's not safe for people to declare their orientation. And therefore, if it is not safe, they're not likely to get the same kinds of intervention. We have a problem right now, a huge issue. Cancer continues, lung cancer continues to kill Americans. We have more money in breast cancer than in lung cancer. Perhaps because we assume that on matters of lung cancer you have choices, and matters of breast cancer they are feeling that you might not. Again, let me just simply say that my job and my mission is very, very simple. To point to healthcare disparities without applying a motive of malice. If I give you an issue of malice as part of what I organize in my package, I'm going to lose the owners of the culture. I'm going to lose the people that need to partner up with us on this important journey of preventing people from dying and suffering more than other folks, and getting a higher incidence of preventable diseases. And so I start with that, with the risk that I may lose credibility with some of you. Some of us are simply single-issue activists. And to the degree that we see this simply as a race issue, we lose the opportunity to do what needs to be done. And so one of the things that I remind audiences throughout this great country of ours is that every significant institution in America, by and large, has been founded by white males. And therefore, we honor what we have in place, and then we work to make it better, to make it more responsive. But for goodness sake, if you seek to change the present and secure a more important future, honor the past. Honor the past. As the pastor was saying, he gets all emotional. And sometimes immigrants know how to love America in a way that some of us that have been far from that immigrant experience, may not. But I am reminded of the fact that America, with all of its flaws, and we have many, is still the destiny of choice. People who are willing to take their chances for shark-infested seas, barren deserts, rivers, and barbed wire, to come to the America that white males have exercised leadership in building and defending. And I'm not saying thank you for slavery. I'm not saying thank you for the Tuskegee experiment. I'm not saying thank you for discrimination or sexism or homophobia. But what I am saying is that there isn't a day of my life that I don't wake up proud to wake up as American. And therefore, the reason why we talk about differences in this business is to make America stronger and healthier and more productive and freer than when we found it. And that means a conscious, deliberate expression of gratitude for these huge institutions in which we seek to play a larger role in order to make that health and that prosperity and that green a reality. We simply have to stop providing motive, evil motive, even when harmful things are the outcome of the fact that we are not always conscious of the legacy of poverty and social injustice and cultures terms of the fact that in America, we don't always get the kind of protection that we need, depending upon the negative meaning that we place on each other, or the positive meaning we place on each other. So my job and my mission is very, very simple. To guide you towards addressing disparities without scaring you away in the process. And in order to do that, we need to be balanced. And to be balanced, we must express gratitude for the leadership, gratitude for the sacrifices, gratitude for the progress. And then we say to this generation of people who are making these decisions, we seek to play a larger role. So people do not have to die needlessly, as they have done at Virginia Tech. Are you with me? Give me a back. Give me a back. I just want to say amen. Because when a preacher's here, amen, that's like telling the dog sick. But you know, we have to be inclusive. And in our prayers, we have to be inclusive. There are those here that do not have a particular religious belief based on Jesus Christ. And there are those of us that do. The real trick when we get into the Navy and we prepare chaplains for the military, we ask the questions, can you be a rabbi to Jews and a chaplain to all? Can you be a pastor to Christians and a chaplain to all? And that means recognizing that other folks have different ways of expressing their ethical concerns. And there are those of us who are believers as the children of Abraham. And then there are those of us who are specifically denominational in context. So there are those of us who pray in the name of Jesus. And so we have to figure out when we're doing our denominational thing, where we can pray in the name of Jesus, and then we need to provide spiritual resources to other believers who may not pray in the name of Jesus, who nevertheless are conscious that they have a responsibility to the Almighty God, and so forth. So it's getting the cultural competencies by which we can be exclusive. To put it in Christian jargon, we must become all things to all folks, whereby we might save some. Amen? Give me a back. Here's what I want you to do. If you are physically able, I want you to stand up and just shake hands with 3 folks that you really know and appreciate, and 3 other folks that look suspicious. Or at least 3 folks that you don't know. First take that. Move around.
Okay. Oh, it's on?
It is now. They didn't know before because you got good voice, but that'll be better for him.
Thank you. Okay, good folks, please take your seats. Listen up. Get ready to take notes. I'm going to speak fast, so listen fast. My name is Samuel. Try Samuel. All of you, come on now. It's like damn well. It's like everything I do. Last name Betances. Try that. Keep in mind that Samuel or Samuel or Sam, Shmuel, is a Jewish biblical name. from the Hebrew Bible, the part of scriptures that we Christians call the Old Testament. Because I have an Hispanic background by way of Puerto Rico, you would assume that my religious background is likely to be what? Catholic. So whenever you hear somebody, and Catholics name their children after what primarily? Like, name some. John, Michael, Teresa, Peter, Mary. Are you with me? So whenever, in fact, Latinos go all out. They even name their male children after Jesus. Which was tremendous pressure when you're trying to sin, I'll tell you that. Hi, big boy. What did you say your name was? Jesse. So you know a Mexican named Jesse, he's lying. It's Jesus. But whenever you have a Latino with a Jewish biblical name from the Old Testament, it probably means you grew up Baptist, Protestant, Adventist, Jehovah's Witness, Pentecostal, Evangelicals, because Catholics name the children after saints. And if you make the assumption that most Hispanics are Catholic, in a dynamic urban experience, that is changing. That being the case, not only that many evangelicals are anti-Catholic. They have left those Catholic churches to enter into the truth. So just because you're working with the Catholic charities and the Catholic community does not necessarily that you're impacting all Latinos. You're impacting a significant number, but keep in mind there is the Protestant side of the equation. And in urban environments, that's a fact, and there are sociological reasons for it. And in a question and answer mode, we can relate to some of that. So we have a richly diverse Latino population. I work for Sauter, Betances, and Associates. If you look at World Wide Web, Betances.com, you find our website. We work with over 200 of the Fortune 5. We work with the military. In fact, I don't know how many of you knew Dr. Edith Mitchell. She was in Missouri with the Air Guard, and now is at the Kimmel Center in Philadelphia. But we work with different organizations, educational institutions. And I just come back from giving a series of 8 lectures at the medical school at Thomas Jefferson and at the Kimmel Center there in Philadelphia. We're working also with the Metro Health systems in Cleveland and so forth. Only to mention that we provide technical assistance in diversity interventions to organizations that are trying to make sense of their differences in order to be effective in achieving their mission and improving their bottom line. We worked in 18 countries and in all 50 states and in all U.S. territories. Sauter, S-O-U-D-E-R, Sauter, Betances and Associates. And if you want to write to me, Samuel@Betances.com. And I will answer. Be patient, because I travel a great deal, but I will answer personally. So we exist to provide service to organizations like yours or endeavors like yours in order to make sense of our differences and so forth. So we're going to talk about diversity as a value-added tool for building an equitable healthcare delivery system. So if my best hopes are met, you will leave with 3 or 4 or 5 ideas, strategies in your leadership toolkit to respond to the needs of addressing disparities across your collaborative network in this region, which might include more than just one state. Could be Kansas, could be Missouri, could be rural, could be urban. Sir William Osler put it well. It's more important to know what sort of a patient has a disease than what sort of a disease a patient has. In other words, and he said this a long time ago, but at the beginning of the 21st century, America continues to be diverse and grows in terms of its differences. And you have to figure out what is it about this particular network, this particular culture, this subgroup, what is it that folks value? How do they communicate? What is worth doing and knowing? What prejudices do they have? What strengths do they have? We have to know where people are coming from. My wife is from the island of Guam in the Pacific. One of the things that happens in Guam is that as soon as somebody is ill, the family has to be present 24 hours a day as part of the support system. Office hours will be over in 15 minutes. That doesn't jive well with people that are going to be there providing prayer, providing comfort, providing hugs, providing a sense of security. We're not going to let you go. We're going to be with you. So when my mother-in-law, Mama Tita, we used to call her, was in her 90s and was at Swedish Covenant Hospital in Chicago, my sister-in-law flew in from Hawaii. Folks flew in from Guam. Other people flew in. Our work schedule changed, and we are with Mom. And there was only one little room. They had a few magazines that doctors know, you know what I mean? They cut out their addresses, you know, and they put these magazines there that had nothing to do with anything that was particularly relevant to us. One television, a couple of seats around, and there is this Sicilian family where the mother is sings opera. The children came from colleges, the twins, to be there. And so there was this Sicilian family. There was an Arab family. And there was this Pacific Islanders with this Puerto Rican stuck in the middle. One little room. And the nurses were acting like we were a disturbance in the force. What were we doing there? Office hours. Are we interfering? Where do we? In one room, uncomfortable, and all three groups wanted to stay 24 hours a day, and there was no room to provide the support to three different kinds of patients, three different kinds of subcultures, and so forth. So one of the great challenges that we have is what sort of patient has a disease versus what sort of a disease a patient has. Because we were key to the healing. My sister-in-law is inside the medical room, and somebody shows up at 2 in the morning, puts on the light. Good morning, how you doing, Mrs. Souders? And then takes the covers and puts them up, and there, you know, she loses her privacy. Gonna wake her up to give her a sleeping pill. And my sister-in-law says, cover my mother up. Put out that light and step out of this room. I want to chat with you. After several days, my mother is finally sleeping. She now knows that her children are here. And you're walking in with total disregard for her dignity, interrupting the healing that is taking place in view of the fact. And from now on, if you could be so kind and gently knock, and I'll step out, and you kind of let me know what it is that you're going to do, and I'll help facilitate the process so that my mother may be comfortable during her illness. She shouldn't have to be fighting the healthcare system. She has enough responsibility and to fight the disease. And so sometimes we destroy with our feet what we build with our hands. Am I telling the truth? Give me a bam. My overview is very simple. We're going to take a look at some challenges that if you address them, make make it better for you to be more effective in the wonderful things that you are already doing. I am a sociologist, an educator, and a preacher of social justice. My mission is to take a look at making sense of differences in a way that will hopefully add value to your quest and our learning goals. If you can walk out of here with 2 or 3 good solid ideas to be more effective, that would please me very much. The challenge, I wonder, for those of you that can see it, I know you can read, it's just a way of keeping you engaged. But I found this to be a wonderful, wonderful quote. And so when I say read, I wonder if all of you could read at once. 1, 2, read. Social position. So social position, economic status, culture, and environments. And I've been very lucky. My mom was very white, European looking, from Puerto Rico. Daddy, he was black. Coarse hair, black skin, flat nose, full lips, not like Mick Jagger, but full lips. They got together and look what they did. That's why I look Arab. Listen up. Sometimes all you have to do to be in trouble in somebody's eyes is just to show up the way that God made you. Am I telling the truth? So I was born racially mixed, parents divorced, poverty. We were so poor, somebody broke into a little apartment and didn't take anything. I mean, that's cold. That's cold. I grew up on welfare, and when you grow up on welfare, there's a lot of stress because you don't have resources, basic resources. So growing up in poverty, in Harlem, and the South Bronx, Violent, New Jersey, the west side of the city of Chicago, you grow up experiencing rejection. And sometimes you don't have the cultural competencies to reject rejection, and you turn, in fact, what you do is you reject yourself. This is one thing I found about alcohol. My father was an alcoholic, and so I try to figure out what drove him to drink, and then there are two factors. Some things drive you to drink, and then the body becomes, what do you call that? Dependent. So, but I wonder, what was it about my father that drove him to drink? And I found out that his father, my grandfather, was a police officer killed in the line of duty at the height of Jim Crow. His mama, died of a heart attack. So he's a little black orphan boy growing up first in Puerto Rico and then in Harlem and in the Bronx. And he never got over that. Never got over that loss. And what he would do, and remember, Jim Crow meant that the society is hostile. And so what happens is, the function and purpose of drugs they are chemicals you put into your life to give you a leave of absence from reality. I want to say that again. Chemicals that change the channels of your moods. It's interesting. Lesbians and gay and some of those folks, if you take a look at the literature, will drink more often and do drugs more often than other groups, in part because they have to deal with the dynamics of depression and rejection. And therefore, if you belong to a group that does not have the same value, you tend to want to take a leave of absence from reality. And that's what my dad did. So he took a leave of absence from reality. And that's what the chemicals do. And so forth. So, grew up in poverty, then illiterate in 2 languages. We simply did not have understandable instruction. I want you to say bilingual education equals understandable instruction. Say that. Okay. So language, multilingual languages equals healthier organizations. It's your ability to let people know that if they're in the United States of America, they better be learning English. But while they are learning English, they should not be in danger for us not providing them and connecting them to the fact that they need to do all kinds of things in order to live healthier lives. Are you with me? So I grew up under those circumstances, and then we grew up in poverty. We simply didn't have enough resources. And I remember that there was a rule that you could not go to school unless you had a physical checkup. And at that moment, this is right after World War II, in New York City, it cost 50 cents. You would take your 50 cents to a doctor, and they gave you a little a medical test, and you then brought that back to the school, and then you could come into school. So I go in to the doctor, and I gave him my 50 cents, and he says, and he looks at me, and he signs it, and I'm out. Well, the next day, we were talking with the other kids, and some of these kids says, weren't you embarrassed when they touch you in your privates and turn you to turn and to cough? And remember when they did this, and then they took that thing that you eat ice cream with, and they say, and so forth. And it was all over the table. It was all over the place. There were those doctors who actually did what was required for those 50 cents. And then there were those doctors that didn't give a hoot. And so technically we have been examined. The reality is that it all depended on whether some people had the cultural competencies and the ethics, and whether they really valued us. Where we were not valued, they just took our money, signed the paper, and left us. Well, eventually my oldest brother became a gang leader because he could not do good in school. That was another issue. And so he did good in the streets. When people cannot be good about being good, they'll be good about being bad, because all of us got to be good about something. And when you can't get your name on the wall with a diploma, you'll get some spray pen and get your name on the wall anyway. And if you can't do it with your fist, you might do it with your genitals. Or if you can't do it with your brains, you can do it with your fist. And everybody loses. So I've been very, very lucky, because I ran into a nurse that I went to work for when I was all of 16 years of age, and she got a hold of me and gave me some direction and gave me a prescription for success in America. And she basically said, you got to read and read and read. You got to develop words. You have to develop abstract thinking competencies and theoretical ways of knowing. And before you know it, I went from being a high school dropout to graduating from high school to going on to college, to eventually earning my master's and my doctorate at Harvard. And today, I have access to the best. You are so lucky, because I know how it works on both sides. And so it's in that spirit that I tell you that my social position today, my economic status, the culture that I belong to right now, and the environments, we have healthy grandkids and healthy children, and we are adding value to your own quest to be responsive. So it's in the spirit of being on both sides of the track that I come to you to deal with this particular challenge. This is the business case. Globalization. Be concerned that this issue of globalization will complicate your quest to provide adequate health care services to an increasingly diverse United States of America. Globalization means that you produce something in one part of the world and sell it to another. What has that done? What does that do to the developed society and the developed countries? Number one, for the first time, listen carefully, it requires that we depend upon people from different countries to be part of our professions. You go to a veterans hospital and I bet you're likely to find South Asian doctors as part of the team. Pakistanis, Indians, maybe Bengalis. The fact of the matter is that people from India who come to this country are important because a lot of American doctors won't do it for those kinds of income, where in one country those incomes are great but not by American standards. So we have to now depend upon people who are different than all of those veterans that fought in wars in the past. And you cannot assume that because you come from India or you come from the Philippines that somehow you are culturally competent. The fact of the matter is that folks come from societies where they have their own levels of stratification. Am I telling the truth? So just because you happen to be a person that quote unquote is of color does not automatically mean that those people know how to communicate and how to guide the process of healing because of their own challenges in their own societies. Am I telling the truth? Just because you come from Chile or Argentina or from the high class in Puerto Rico or Venezuela or Mexico does not automatically mean that just because you took care of the language issue that you're taking care of the caring issue. Are you with me? Give me a bam. So don't be satisfied that we got somebody from Argentina. Well, good for you. Where is your cultural leadership institute so that you can be sure that they can provide services to all kinds of folks? Because in a lot of our own societies, we come from very stratified societies. My cousin is a medical doctor who was educated in Spain, from Puerto Rico, who told my niece that if she married a black person in Puerto Rico, she would be totally disinherited from the family fortunes. In other words, we are not culturally competent because we belong to a gender group. We're not culturally competent because we have certain characteristics that we call racial. We are culturally competent because we understand how we must be responsive to people, and you must be dissatisfied with the status quo enough to have left what you have left undone to come to a meeting like this one and to listen and to take notes and to network, because you are not born competent. No one is born qualified, and we have a responsibility to qualify our professionals to be responsive across class, across gender, across age lines, across a religious line, across sexual orientation lines. Are you with me? Give me a bam. So globalization will increase the numbers of legal immigrants because we need them at the high end. America does not produce enough engineers. We're not producing enough scientists. And by the way, think about Cuba for the moment. We expect that no matter what happens to Fidel Castro, in 72 months, his brother Raul will probably be about 81 himself. There will be a generational shift in Cuba, and something is bound to happen. Do you know that Cuba has produced the largest significant number of medical doctors, and they're all over Latin America? Are you prepared to get your fair share of talent should they choose to come? I know that baseball is already looking at that possibility. Is healthcare industry, are people in the healthcare also looking at those possibilities? We have to anticipate the future. Lastly, in relates to globalization, we are going to get more undocumented workers. We need people to work in that cattle industry. We need people to work in agriculture, in hospitality, in manufacturing. Are you with me? Stay with me on this one. Because we make success, we need people to do a lot of the schlep work. And there are racial tensions involved here. Because if you come from Central America, you're making 20 times more than you made back there. And you want to improve the quality of life for your family. Are you with me? And black people are saying, wait a minute, that's minimum wage. We're not going to get benefits doing it for that kind of money. But for those folks, 2 or 3 of them working, sending money back home, that's maximum wage. And we have a conflict. Black people are not upset because people from Central America and Mexico are taking jobs that black people want. No, black people are upset because many of those folks are taking jobs for money that won't give you benefits and access to health care. Are you with me on that one? And so we have a huge challenge between black and Hispanics. And so while blacks see Hispanic immigrants protesting, they can identify with protests against inequality, but they don't always feel sympathetic about people who are coming in who appear to be complicating their quest of black people to have access to health care. And if you don't know what I'm talking about, read the book by Barbara Ehrenreich, Nickel and Dime in America. She used to say that at one time in America, if you didn't have a job, you were poor. Today, being poor means having 2 jobs and not making ends meet and not affording health care. Are you with me? All right, give me a bam. Say bam. Bam. Just like Emerald the cook. Bam. Bam. Let's kick it up a notch. Bam. Bam. Así se hace. All right. So, in Korea, they call globalization. The impact of globalization is called the 3 Ds: dirty, difficult, dangerous work. And good people, please resist the temptation of believing the Lou Dobbs of the world, that somehow our country and Pat Buchanan is going to pot. Because you got people coming into this country to try to make life better for their families. Keep in mind, I want you to say, America was founded by outsiders. Say that. Who are today's insiders? Who get very nervous about today's outsiders? The Pilgrims were illegal aliens. They did not give their passports to the Indians. And we consider them heroic. Are you with me? Well, if these folks from Central America and Mexico and the Dominican Republic and other places are coming to this country for the same reason that the Pilgrims came, then we should not criminalize them as felons. We should protect our borders, but we should not treat people inhuman because they're doing what the Pilgrims did. That requires a cultural shift. Demographic trends. Women not only want to be nurses, they also want to be doctors. Women have discovered that if you take that science course to be a nurse, it's the same science course you need to take to become a doctor. 55% of medical students in flagship universities are likely to be women, and not because of affirmative actions, but because of demographic shifts. Further, women are now graduating 12 and 14 times more often from college than men. And women outnumber men. What does that mean? Is that women now constitute the biggest source of brain power in the United States of America. As my wife says, real women do not have hot flushes, they got power surges. What does that mean for health care? Listen, listen. It means you have to provide women meaningful assignments that qualify them for upward mobility. This business of heightism has to be addressed. The average CEO in the United States of America is 6 feet tall. 30% of CEOs are 6 foot 2 inches tall. Only 3.9% of the population are that height, have that height. Consequently, what happens is, if you have this height, you're likely to be provided with mentoring, you're provided with meaningful assignments, and therefore taller people become more qualified, not because of their DNA, but because of our bias towards tall people. Are you with me? If we do that on height, we are also doing that on race, and we're doing that on gender, and we're doing that because of people's accents or the lack of accents. So what we're trying to do is to understand that these are the demographic trends, the numbers you cannot ignore. 52% of the preschool children in the state of California happen to be Hispanics. The United States has 41 million Hispanics as of July 1, 2005. By 2020, we're talking about 60 million. By 2030, we're talking about 73 million. By 2040, we're talking about 88 million people of Hispanic descent, and most of them American citizens. The real explosion is not the immigrant from the outside, but the American citizens having children in the inside. Please do not be alarmed. We can bring a particular attitude and framework to this important area of work. Like me, it's been my privilege to defend American interests in 2 languages, good for America and good for me. Are you with me? Give me a band. But the fact remains that we have demographic trends. We're getting older. We're living longer. In the 1950s, you retire at 65 and you died at 67. And you died all at once. Well, now you retire at 65 and you got what? Another 10, 15, 20, 30 years? And you don't die all at once. You die one part at a time. There are 20,000 licensed drivers in South Florida over the age of 90. You'll be down there and you'll see a big Lincoln drive by and there's nobody inside. What does that mean? In healthcare, we got to figure that one out. But if we don't have productive people working because of prejudice, they're not going to be paying the bill that will enable us to have the resources to help our elders. Are you with me? One more thing you should know. The middle class is having fewer children. Since white people are likely to be in the middle class, white people are having fewer children. That being the case, we better grow the people we have. And when you are teaching and you see minorities come into your organization, kiss them. That's your bread and butter right there. Are you with me? Huge demographic trends. Cultural shifts. Here's a big one. For the first time, we have to educate students from poverty in our schools. And we don't know how to do that. And that has implications for healthcare. Let me give you an example. When the English came and took land from the indigenous, then you had other groups come. The Scots and the English went up. Then the Welsh and the English and the Scots went up. And then the Irish, and then the Germans, and then the Poles, and then the Italians. And people basically moved up and moved up and moved up and moved up. And all of a sudden now we have globalization. So we don't have a new group coming in and making sure that the next group moves up. Since we do our cheap work overseas, we now have a people that are not going to move up unless they become educated in middle class places called school. We've never, ever had to do that before. Let me give you one illustration, and then I'll move on. Uri Treisman at Berkeley realized that you had to take calculus if you wanted to get into the healthcare professions, or if you wanted to get into engineering. But he found out that white and blacks and Hispanics and Asians were having different outcomes in calculus, which was the gatekeeper to engineering and science. And what he found out was very fascinating. He found out that white students did very well in calculus. Okay? Asians did very well in calculus, but the blacks and Hispanics were not doing too well in calculus. Now remember, to get into Berkeley, you had to have grades that were very, very high. So they all qualified to get into Berkeley. So he asked, why are they not getting through Berkeley, especially in the area of the sciences, which are so badly, so important, so vital to healthcare? So he followed them, and he wrote his doctoral dissertation on what he observed. And what he observed was that everything was the same for all students. Same classes, same teaching assistants, same textbooks, same homework assignments. Everything was the same, except that after supper, the white students networked and got together and studied with each other and compare their notes, anticipating what was going to come in the class the next day. They clarify things. They help each other in small groups. The Asians study in groups, but the blacks and the Hispanics went as individuals to study. So he asked them why. And then he realized why they were not getting the grades that they could have gotten. It seemed that if you were black and if you were Latino, you were likely to be a first-generation college student. That meant that if you wanted to get out of the hood, if you want to get out of the barrio through education, you had to get the best grades. Whom would you have to stay away from? Your peers. In other words, you stay away from your friends if you want to get good grades. That got them to Berkeley, but when they got to Berkeley, the one competency they had was that they did not know how to study with anyone else except themselves. So what got them to Berkeley couldn't get them through Berkeley. Are you with me? And that's when Treisman, who is now teaching at the University of Texas in Austin, that's when he said, if you teach chemistry, you're not teaching chemistry, you're teaching chemistry across generational lines. And if that's the case, you got to team up your first generation students with your second and third and fourth generation students so that you can all grow and we can get the talent that we need. And we need to have the cultural competencies, not to be abstract. Don't be led by believing you are teaching a subject matter. We're teaching human beings, and that's a cultural competence that we need. I am going to move rather quickly because my time is almost up. Do me a favor. Don't leave the room, but just stand up. Just restore your levels of alertness. Slap skin with somebody close to you. All right, take your seats. That's called restoring your levels of alertness. After my presentation, you can restore your levels of comfort. Listen, number one, you got to become dissatisfied at the outrageous stats. Recognize that social injustice related to race and class drives some of these disparities. Don't take it personal. In other words, it's not you as a member of a particular group, but that those are generalized patterns the research indicates. For example, we have found out that the research of Dr. Freeman, Harold Freeman, from the patient project, navigation project, found out that if you and I are part of the middle class, you and I are part of the middle class, I happen to be black, you happen to be white, we have the same level of insurance and the same social economic status, and we go to our doctors and they discover the beginnings of cancer, the white person is likely to have the procedure to remove it, but not the person of color. So something is at work. It's like heightism. We are biased towards height for certain things, and we're biased towards race, towards certain other kinds of interventions. And that's the research. The research indicates Bach in the New England Journal of Medicine in 1999. You gotta team up with people that look different than you. In baseball, people across racial lines pursue common goals of winning championships. In football and in basketball, the same thing in the area of medicine. You got to be able to team up with people that are significantly different than you. Make sure that the pipeline, the talent pipeline, is inclusive in nature. Find out who is missing. And if you don't know where to go to people that come from that demographic groups and talk to a significant critical mass of them, 3 or 4 or 5 of them, about what worked for them, and then that's how you get your best practices. Make sure that your budget for upgrade includes training on disparities. Make sure that it just doesn't come out of the Department of Human Services or the Surgeon Generals, or it doesn't have to come from the outside. Part of your training in the inside is to provide healing and to do it in that area. And don't wait for all the research to be in. There are some things you can do right away. So let's talk about diversity. Diversity means when you say what is diversity, your ability to basically work with differences to leverage your differences to achieve the mission of your organization. So we have workforce diversity with race and gender and race, and then there's cognitive diversity. I just gave you an example of cognitive diversity. First generation college students have learned to study alone. That is deadly for getting through research centers and flagship universities and complex programs. So that's a diversity that you have to be aware of. Structural diversity means basically your ability to take a look at something that is needed across organizational lines. The Air Force needed a jet that had stealth and speed. The Navy needed a jet that could land on an aircraft carrier and take on the ocean and the salt and so forth. The Marines needed a jet that could land like a helicopter and fly like a jet. They were each working on a jet that would cost more than $100 million plus each. During the Clinton administration, they decided to challenge the military to see where they could work together. They found out that 85% of the jet that all three needed was the same. And about 15% or 20% was unique to their services. They now have built a jet for $35 million instead of $100 million each prototype. And so forth. So what happens is that they communicated across line. Dr. Harold Freeman, the patient navigation program, created a strategy for helping the healthcare provider and the patient to be able to have access to these particular services. I was working recently with the Metro Health Services in Cleveland, and they said, Dr. Betances, the problem with these programs that the federal government will give us is that we get them and we get the soft money, and when the soft money is gone, we then go for another grant of soft money in some other area, and we don't always have the wisdom that we got from the patient navigation program. We never make structural and permanent in our organization. And so that's part of your challenge. Basically, Dr. Friedman basically said that poverty was part of the challenge. If you're poor, you don't have enough words to understand. If you're poor, you don't have enough of tradition for reading. The average family from poverty has 800 words. The average family from the middle class has 3,500 words. Consequently, in families of poverty, they don't read as much and don't comprehend as much as they could, even if they read. So one of the great challenges that we have in poverty, we lack information, we lack knowledge, plus we have different kinds of habits. Culture means that you belong to a group that either works to enhance health care or does not. If you happen to be a Seventh-day Adventist, and if you happen to be a member of the Church of Latter-day Saints, and if you happen to be a Jehovah's Witness, and you don't, or evangelical, etc., to the degree that you don't smoke and you don't eat meats as often and you don't drink and do stuff, that affirms it. At the same time, we have subgroups. My brother loves to stand up and jive and drink and smoke and tell jokes and whatever, and his whole thing is he belongs to a subgroup of folks that do a lot of entertainment in front of the stoop or by the bar, and they're constantly doing things that are absolutely destructive. Are you with me? So there are cultures that work towards health, that have good health outcomes, and then there are cultures that do not. Lesbian women, to some degree, if you look at the research, the issue of they reject the ideal of this thinness that causes different kinds of health problems versus people who are likely to gain weight and so forth and so on. So you're likely to deal with that issue. 56% or more than 50% of African American males in Harlem are likely to believe that if you open up a person in terms of cancer, if you open up a person that has cancer, that you will die. That if you expose cancer to fresh air, you will die. Where does that come from? Basically, people, by the time they try to get attention for cancer, the cancer is such an advanced stage that by the time you open them up, all you got to do is close them up and then they die. And so now we are recycling the idea that if you open people up, they die, when the real problem is that they're not included early on in terms of the examinations process. Are you with me? Give me a band. So there are different cultural and subculture. Social injustice has to do with racism, with the lens. We got to be very careful the way we discuss this, because we scare people. Because we throw acid in people's faces and then we wonder why they don't want to play. But the fact of the matter is that when people do wrong to people, in order to justify the evil they do, they put a negative meaning on the physical characteristics of the people they oppress, and then they blame the people they oppress for their oppression. So if you enslave God's children, in order to justify that, then you make of God a racist. Are you with me? So we live in a situation where people actually believe that we ought to be separate and not married and not relate to each other because God said. And so if we make it holy, and then we now make it even social scientific, pseudoscience tells us that we should be separate. And some of us, our views as use handkerchiefs, and others, our views are flags. You as a healthcare provider must figure out how to make sure that racism does not interfere with that. Structural diversity is like the Kimmel Cancer Group's 22 centers, and what you have here is you have to have cooperation against structural lines. And global diversity, if we don't take care of people's health needs from the global arena, be careful of epidemics. and so forth. So those are challenged. So demographic, cultural shifts, we need cultural competencies, we need collaboration for addressing disparities, we need to target respectful discrimination. Very often you have minorities and women in organizations, and we participate in what is called pre-selection. Pre-selection is you have to post the position, but you already know the person that you want. So you take the person that you want, and you give them assignments, and you write them up, and you give them mentoring, and you write the job description so that they are the only person in the whole world that qualifies for the position. By the time you post the position, you might as well put a photograph of the fool who's going to get the job. Are you with me? Give me a bam. So we've got to be able to prepare more people for leadership than we've been able to prepare. And remember, diversity is not about counting heads. It's about making heads count. And if you get soft money from the government to discover a new strategy for your structure, make sure you're just not changing the bulletin board, but the organizational culture in the process. Are you with me? Give me a bam. And so forth. So literacy, the politics of language and patient safety. The lack of literacy among the poor. There is a new book out called How Doctors Think. The average doctor, if you're middle class, will interrupt you 18 seconds after you started speaking about what you're feeling. The average conversation is 18 seconds. People from poverty don't even get those 18 seconds. And so there's a whole literature on communication and so forth. Also, in the United States of America, we are anti other languages because we think it's going to endanger the fabric of the society. And what I'm saying to you is that that is a concern. But in the healthcare professions, don't be afraid of putting signs and having somebody in the front desk, not only that speaks the language, but that is culturally competent and responsive to the needs of people, and on and on and on. I could have taught this whole thing. I could have shared with you my whole time just on the issue of a language. Remember, diversity, bilingual resources is to make the healthcare interaction between patient and doctor better understood. It's not to destroy the fabric of American society. Anybody who says you can get along without English in the United States of America is a fool. Anybody who says that you can be the best American knowing only English is a greater fool in the age in which we live. So we need to be able to work on that. What did the doctor say? You need to read this, the Joint Commission, Improving Health Literacy to Protect Patient Safety. I found that to be extremely valuable. Doctors talking with patients, patients talking with doctors. Absolutely wonderful. This one, bilingual education, the politics of bilingual education. I wish I had time to talk about this. But power, language, and the education of African American, the question of black English. Black English, what is black English? Basically, people are stolen from their land, forbidden to speak their language, cannot go to school to learn middle class standard English, cannot be taught to read and write in informal settings, have to understand what the master society is saying, so black people invented their own version of English. That's a reflection of intelligence, not of stupidity. So that you build. So when you see people talking black English, I know why you talk black English, because you are a descendant of a wise and ancient people who had to survive in a hostile environment. Welcome. We'll give you the best training. Continue to go to school, learn middle class standard English, and you know 2 ways in which to serve your community and your profession. Are you with me? Amen. So anyway, the debates, dying to come across the immigrant tragedy in American history. Jorge Ramos, who was an undocumented person who's now on the television. Poor white people. They have no advocates, hardly any advocates. So don't just be talking about Hispanics and blacks. In rural America, let me tell you something, there are a lot of poor whites, and they're not on anybody's agenda. They've got to be on ours. We have to be champions of addressing the needs of the poor, not just the Latino poor or the black poor or the Native American poor, but we also need to address the issue of the white poor. And if we do that, we'll be able to do stuff. Incorporating patients' perspective on culturally and linguistically appropriate services into current measures of quality will provide important data and create opportunities for providers and health plans to make improvement. Dr. Beal, this is where we're getting to questions, but let me just give you a couple of resources. Number one, please listen. We provide training for people to become practitioners in diversity area. We have a huge need. Some of you are well-meaning, you just may not know how to communicate this stuff effectively. Some of you are passionate, but in the process, you may be throwing acid in people's faces. How do you make the mission case without scaring your stakeholders? And so forth. So we do training. Please send 1 or 2 or 3 people from your organizations to become effective diversity practitioners. We do this in Chicago. By the way, the Navy is sending us 10 and 15 people to every class because they're looking at how do you develop in the military. So we might as well do it for people like yourself in the business of the Surgeon General's office and health providers. If you don't read, you can't lead. There are a tremendous amount of books. Go into the mayoclinic.com and they have one of the best lists of resources. And if you think you're a leader and you look back and nobody's following, maybe you're just taking a walk. Reverend John Maxwell talks about that. So let me, how doctors think. And this has to do with the fact that doctors don't spend much time talking to patients. It's a wonderful new book by Dr. Groupman. Again, what did the doctor say? Some of you are already acquainted with the issue of disparities and unequal treatment. In nursing, how do you care for patients from different cultures? Cultural diversity in health, illness, cultural competencies in healthcare. You also have implementing diversity, working across generations, women and men in areas. When generations collide. A Jew in Austria, in a concentration camp, a psychiatrist, had to find meaning. I read this book when I was attending Columbia Union College in Maryland. It changed my life forever because I had to read and read and read. And I read about this Jew, and I asked myself years later, what else died during the Holocaust at Auschwitz in Dachau? When you consider that 90% of the Nobel Prizes in the world have been earned by Jews. 90% of the Nobel Prizes in the world. Imagine that perhaps the cure for cancer, for some cancers, might have died at Auschwitz. Hatred is destroying all of us. We've got to figure out how to get rid of anti-Semitism, homophobia, racism, languageism, religionism, heightism, ageism, sexism. We've got to be able to do better than that. There are 12 lectures that I give communicating diversity. So as you drive and you want my voice to be with you, it's a rather soothing voice, might help to add value. Managing cultural differences for global leadership and so forth. How to mentor. We need to mentor across identity lines. White women and black women have separate paths in professional identity. Jim Wallace, FaithWorks. I love this book. If you are seeking ways for faith communities to work with you in healthcare disparities, look at this book as a role model. Become a champion. Become a champion for the poor. Remember that Pharaoh had the power and Moses had the authority. Remember that Haman had the power. Esther had the authority. Remember that Pilate had the power. Jesus had the authority. The medieval popes had the power. St. Francis had the authority. The British government had the power. Gandhi had the authority. And the southern governors had the power. Martin Luther King Jr. had the authority. The great growers had the power. Cesar Chavez, Dolores Huerta had the authority. And Pretoria, South government, they had the power. Mandela had the authority. And somewhere along the line, you've got to face this issue of healthcare disparities with the authority and the ethics and the concern that people must stop dying needlessly if we just know how to make these coalitions of interest instead of coalitions of color to make healthcare a real possibility. Are you with me? Give me a bam. He just got out of Cuba, speaks 5 different languages, and can tell you a little bit about what's going to happen probably in Venezuela, Bolivia, Peru, Nicaragua, and Brazil. Antonio Morales Pita, go into the internet, get his book. You will love it. I wrote a book. It's not a book to be read. It's not theoretical. But it's about how to study. It's called 10 Steps to the Head of the Class. I was a high school dropout who graduated from Harvard. And I'm trying to get students to stay in school and graduate from high school and go on to college. And I have that little book. It costs $13. I have about 15 copies. If you want to, just write a check to New Century for $13, and I'll give it to you before I go. But we need new resources. Mayo Clinic Education and Research, an extremely valuable research, and of course the Commonwealth Fund. Wonderful. Go into the internet, look at the Commonwealth Fund, and you will spend 3 or 4 hours online increasing your cultural competencies. Ladies and gentlemen, thank you very much. I'll remain around here for those of you who want to come up and touch me afterwards.
Before we start to touch him, I just wanted to share our deepest thanks, but it's hard to share thanks in an envelope. It's hard to share thanks with a check. I'm sure you want a check though anyway. But what we really want to share is our hearts with a brother that's in the trenches and someone who has the ability to share learnism. Because you mentioned all these isms. Well, I'm still trying to learn as well, and I think everybody else is here. I'd like to just, on behalf of the colleagues that came together to try and help in having you here, we wanted to share that with you. Thank you so much. Are there any questions for this gentleman?
If there's one quick question or comment or complaint. Yes, if you could be so kind, shout it out. Is it possible? I'll leave the presentation with the group here. And who's in charge of this? Where's Ratterman and company? And isn't she wonderful? You know. But Gwen, thank you. And then we'll share that. There are a lot of speakers that don't want to do that. And, you know, this is kind of and all that. I think if it adds value and if it makes it possible for us to be more effective, we have to stop thinking of ourselves as movie stars. And we are public servants. So I'm happy to leave them. And then you can do a printout. And above all else, Samuel@Betances.com. Be patient with me. Write to me. And I'll be patient. But I will answer my emails and put diversity quest in the because we get about 40,000 pieces of spam. So if you put diversity quest in it, I'll get it that way. And again, if you want a copy of the book and stuff, and I'm really excited to be here, please invite me back, and specifically to deal with some of these subtopics like the issue of language and so forth. And thank you.